CAR T therapy is becoming more and more common these days, especially in the lymphoid malignancies, with more and more indications being approved by the FDA. One of the challenges with CAR T is the side effects. So they are expected side effects, they are serious side effects, especially the cytokine release syndrome and the neurotoxicity, that require significant amount of monitoring. Patients are asked to be near the hospital, close to the hospital, or being hospitalized for several days just for that monitoring component. The problem with that is that the development of that is unpredictable. So we know it will happen on most patients, we don't know when that will happen. So that's one of the biggest challenges with that, requiring a lot of monitoring and a lot of resources. The management of the most common complication, cytokine release syndrome, neurotoxicity, has been evolving over the years as well, as we are becoming more and more proactive on treatment. In the early days of CAR T, would wait until higher grades of toxicity for intervention with tocilizumab, with steroids, and now that's becoming more and more moved to the earlier stages of toxicity, which has honestly improved significantly the number of severe adverse events or severe reactions with these patients. But what we have learned the last few years, one, be more proactive in the management of these complications earlier when they're developing, when they are less severe. We have been using different lines of therapy from IL-6 inhibition, going through the use of tocilizumab, cetuximab, of course. The use of steroids have always been there. So I think those are the biggest challenges or new events in the CAR T management. Now, for the second part of the question, how to treat or when to treat patients that are progressing after CAR T, it's a complex question, and I think it really depends on what treatments the patients have received before CAR T, how they have responded to those treatments, as well what their disease-specific subtype is. There's a lot of thoughts or questions about using checkpoint inhibitors or immunotherapy, bispecific antibodies. Of course, there are several new treatments, especially for the LBCL, that have been using post-CAR T, Pola-BR, tafasitamab with lenalidomide, loncastuximab now. So there are several new options coming up, but I think it really depends on how the patient was treated before and how they did before CAR T.